Next, I'd like to introduce Jenny Buckley, Director of Policy at Innovative Medicines Canada. On behalf of Children's Healthcare Canada, Jenny, I'd like to say thank you to IMC for its support of the conference, and I'd like to welcome you to this stage. If we could all please welcome Jenny with a warm round of applause. Thank you.
Good afternoon, everyone. It's my pleasure to introduce the final panel session of what has been a fantastic conference. So big kudos to Emily and the Children's Healthcare Canada team, as well as their partners at CHEO for pulling together an inspiring few days. So as Michelle mentioned, I work at Innovative Medicines Canada. For those of you who don't know IMC, we represent Canada's innovative pharmaceutical industry. So we work with our members as they help to discover, develop, and deliver innovative medicines and vaccines. We also work very closely with government and other partners to ensure that cutting-edge innovations are available to Canadians. Right now, that process takes far too long. And as many of you probably know, there's far too many Canadian kids that are missing out on innovative treatments that are available to their peers in other countries. So really looking forward to the opportunity to work with the leaders in this room and your teams across the country to find ways to ensure that Canadian kids have access to the best that science has to offer so that they can be healthy and thrive throughout their lives. So now on to the panel. With an election underway, CTV political correspondent and Power Play host Vassy Kapelos will engage a panel of political experts to explore strategies for ensuring that children's health priorities are on the agenda for the new government, whoever that may be. We'll know very, very soon. They'll talk about sustaining and building on the momentum that you and your teams have built over the last number of years, and also how FPT governments can be more engaged and work together to really make sure that the priorities of Canada's kids are met. So joining Vassy on the panel are David Hurley, who's a political strategist with Rubicon Strategy and also the host of the Hurley Burley podcast, Kathleen Monk, who's a political commentator and public affairs strategist, and finally, Kory Teneycke, CEO of Rubicon Strategy. So I will now hand it back to Emily. Thank you.
I'm really excited for this next session. When it comes to the health and well-being of Canada's kids, we're probably a pretty biased group in this room today. I'm not a professional pollster, but I'll bet that every single one of you would rank children, youth, and their families as a top priority for this country, even today, maybe even especially today. Last month, Children's Healthcare Canada was invited to participate in a parliamentary roundtable with the brand new Federal Minister of Health, Kamal Khera. The focus of our discussion that day was the impact of the U.S.-Canada relations, and we talked a little bit about this yesterday. More specifically, the reciprocal tariffs that were potentially coming and might impact Canada's health systems. In consultation with our members, we were able to pretty quickly summarize what was keeping child health leaders up at night on the topic of tariffs. Many had some very practical concerns that related to the costs of doing business. Costs of preparing meals for patients would increase. Costs of essential medicines and medical devices might increase. Access to drugs could be impacted. Philanthropy and community giving would likely decrease. But the dominant concern that our child health leaders had that they shared with me was the direct impact that tariffs and uncertainty would have on children, youth, and families. Uncertainty about the future. Uncertainty about their jobs. Uncertainty about the ability of their families or of their own ability to meet their families' basic needs. This is pretty heavy stuff. And again, like we reflected, not dissimilar from the stress and anxiety that gave space during the COVID-19 pandemic. During those times, we saw measurable increases in the demand for community and hospital-based mental health services. Social services reported an increase in instances of child maltreatment as families struggled with unprecedented stress and pressure. For systems struggling to meet the needs of Canada's children, youth, and families today, there is grave concern amongst child health leaders about our ability to collectively meet the net new demands for healthcare and social services. This was the priority that I spoke to the minister about. Of course, we still have a long way to go, forging healthcare systems purpose-built for kids, responsive to their unique and evolving healthcare needs. The growing population of children in this country are waiting longer than ever for essential services. Across Canada, many kids are struggling. 1 in 3 kids are overweight or obese. Canada has the highest rate of adolescent suicide in the world. 15 to 20% of kids are not fully immunized. 1 in 5 kids live in poverty. 1.8 million children have a diagnosed rare disorder. 20% of youth live with a chronic disease that limits their abilities and activities of daily living. And nearly 1 in 10 kids live with pain severe enough to interfere with school, social, and family activities. Today is April 15th. We are past the midway point of the election and on the precipice of 2 debates amongst leaders. Our discussions related to political relationships our discussions have been focused to date on political relationships with our friends in the US and, of course, the impacts on our economy. Yet, still, speaking with everyday Canadians, health and Canada's healthcare systems still rank consistently as a top priority in this election. Curious about Canadians' views related to children and their health, Children's Healthcare Canada commissioned a poll conducted by Abacus Data, and here's what we learned. First and foremost, children's health and their healthcare can be on the political agenda. Importantly, Canadians see a link between healthcare. I don't have a clicker. Thank you. I do have a clicker. Canadians see a link between healthcare and the health outcomes of their children and government decisions. This gets back to the conversation we had yesterday about political determinants of health and the policies and investments that governments choose and the impact that they have on children, youth, and their families. When we think about health and we think about voting intentions, we see that there's no real clear winner when it comes to a party that's seen as moving the yardstick or the dials further with respect to health and healthcare. Pretty tight race amongst the Conservatives and the Liberal parties. We've seen recently in the last 24 or 48 hours, the New Democratic Party, the NDP, speaking a little bit more about healthcare issues, and potentially there's some room to move the dial on this poll. But the bottom line is, not that, the bottom line is Canadians want equal and adequate access to children's health care. This next slide is pretty telling. So we asked Canadians, if you had $1 to spend in our healthcare system, what proportion would you spend on children and their healthcare services, adults and the health services they require, and seniors, their physical and mental health? Maybe not surprisingly, most Canadians saw a pretty equal divide amongst these priorities. But those of you in this room will know that this is not the reality of how our funds are spent in our healthcare systems today. So if not now, when? When do we make children a priority, especially when we know so many children are waiting longer than many adults for essential physical and mental health care services, surgical procedures, child development assessments, diagnostics? 41% of parents that we polled were not confident that their children would receive timely access to the healthcare services that they needed. And yet 92% believed that investing in physical and mental health services and infrastructure for kids would create a vibrant and prosperous future for our children. We've talked a lot about the necessity of earmarked funding for children's health services. Often the needs of children and youth are disregarded or considered less important to other priorities in our healthcare system. But Canadians believe in large numbers that governments should be earmarking funds specifically for the use to improve healthcare services for children and youth. I like to think we have a pretty compelling message to share, but it's not being heard. I'm going to welcome our esteemed panelists to the stage to talk to us a little bit about why this is, what opportunities that we have to insert children, youth, and families and healthcare more broadly into the conversations over the next 2 weeks, and how to best position ourselves for conversations with the new government. Please give our panelists a round of applause.
Hi, everybody. Thank you so much for having us, and thanks for the introduction, Emily. I appreciate it, and all the data points as well. They're kind of startling in some respects, but in others kind of expected. I'm very happy to be here in the middle of the federal election campaign with the three of the smartest political minds I've ever encountered. And I thought that maybe before we get into the specifics of healthcare more generally, whether or not it's factoring into this election, but also particularly where kids are concerned, that maybe I'd start off just with a general question on the state of the race right now and the election. In sort of your view, and David, I'll start with you on where things are at.
Well, it appears to be. Well, by the way, thank you. It's great to be on a panel with you. I never get to be on a panel with you. I think it's in maybe a little bit of flux, maybe moving a little bit. It's been remarkably static through the course of the writ period, with the Liberals being in the mid 40s and the Conservatives being in the mid to high 30s. The most relevant thing being very large Liberal leads in Quebec and Ontario, which will throw off a lot of seats. There's some evidence that it's tightening, and it's tightening in a way that I think is interesting for this conversation, because it's tightening in one respect along age lines. So, according to the tracking that's being done for the Curse of Politics by Polera, the Poilievre and the Conservatives lead Carney and the Liberals by 18 percentage points among men under the age of 35, men 18 to 35. And Carney and the Liberals lead Poilievre and the Conservatives by 23 points among women over the age of 55. And there is, I think any government's going to have to pay attention to what young people are saying in this election campaign, which is they're not as focused on the Trump issue and the Trump threat to Canada, because they remain most focused on their own personal circumstances, which are bad enough that they are not that troubled by the Trump situation. Much more focused on what's going to happen to give them a chance to buy a house or have a decent career, or to get ahead. So, I mean, I think that where we're at is a likely Liberal majority. I think there's virtually 100% chance of a Liberal government. And likely it's a majority. But the last week and a half will matter. I don't think the Liberals are running the greatest campaign in the last little while, so maybe that will hurt them, maybe not. But certainly there are lots of fissures that are going to exist in the country after this election campaign. Urban versus rural. So in all the rural areas, between Winnipeg and Vancouver, the Conservatives are going to get more than 60% of the vote. And in Vancouver, Winnipeg, Toronto, Ottawa, Montreal, the Liberals are going to get more than 50% of the vote. Massive urban-rural divide in the country, in addition to the age divide and the gender divide. So Poilievre is overall winning men, and Carney is crushing among women. So there's lots of divides that are being exposed by this election, and a lot of work for whoever the government is afterwards to clean that up.
Yeah, massive challenge, likely. Kathleen, do you think it's fair to say that it's a likely Liberal government at this point? And what might change that, in your view?
Yeah, I think it makes sense.
it makes sense that the safe money for sure is on a Liberal government, whether it'll be a minority or majority, who knows. But I do think that the polls don't tell the whole story about the Conservatives. I do think that they potentially may overperform their numbers that we're seeing. Their base consistently of voters is around 30%. We've been saying that since the Harper years. And now their base has creeped up and it's pretty solidly at 35, 37, maybe 38. And Poilievre has grown that extra 7%. And it's a very distinct demographic. And it is, as David said, a lot of young men. I was doing a project earlier this year, and there was just nothing. There was nothing the research, no matter how much research we did, to try to find a message that could break through to that cohort of men under 30. It was really difficult to try to shake them loose from Poilievre, because that was the goal of the project. Like, what could we get to move those men? On the other side, as David says, the progressive parties, both of them, have the women with them. So younger women tend to be with New Democrats, but women of all ages, all demographics, move away from Poilievre in the high double digits. And so I think he's right when David says that we are going to face a challenge post-election. And we're going to have to call on, the better angels to ensure that we don't have kind of a repeat of the kind of divisiveness that we saw in the U.S. post-election. I mean, early on in this election, I'm one of those losers that watches all the campaign events and the feeds online. And if you watch them on the party channels, you get a lot of the supporters' commentary throughout the whole thing on their YouTube feeds. And from the very beginning days of the Conservative campaign, you were seeing phrases like too big to rig. And I do think that, we have a responsibility to have, a discussion about how things will look post-election. And it's my hope that we don't see a repeat of what's in the States. What else can I tell you? I would just, call on all of you to get out your pens. And I meant to bring this email address and I don't have it, but Google it for me if you will. And look up the email for the Debates Commission. Find that info at the Debates Commission. And listen, I used to be a television producer, so I know how hard it is to produce a show like that. It's not easy. You're herding cats. You're dealing with parties. You're negotiating all these things. You're negotiating with the broadcasters. It's horrible. But the fact that the Debates Commission has put forth two debates, in two languages, and they are not addressing healthcare is shameful. And they need to hear from you. They need to hear from you now. It is not, when it's the top 3 issue amongst Canadians and they're not even addressing it. I mean, I'm already pissed at the Debate Commission for a whole bunch of reasons. I don't really think they should be letting the Greens in. They don't really meet any of the criteria. Like, I could go on and on and on. I don't like the format, all these things, I'm not sure they do it any better than the broadcasters used to, blah, 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 blah. And I advocated for a Debate Commission years and years ago, but it's a disaster. And so they need to hear from you. They need to be called on the mat and said, this is ridiculous. When it's 6.5 million Canadians don't have a family doctor, when there's 32,000 nurses positions that are open in our country right now, and we're not talking about healthcare. It's crazy. So please email them.
So I'll pick up on that point, but also I want to get our own better angel, Kory Teneycke's take on the overall state of the federal race, and then I'll sort of subsequently.
There are people who don't know it.
Yeah. So subsequently ask you, because Kory ran Doug Fort's campaign in Ontario, where healthcare, once again, if you look at any polling, particularly during a provincial election, rates very, very high on what people care about. But it did not end up being the factor, I think, in particular, the opposition parties wanted it to be. So maybe first, I'll just get you to briefly lay the land federally. And then if you could give us your analysis on why that ended up being the case in the Ontario election.
Yeah. Well, I'm not terribly happy with how the race is going federally as a Conservative on the panel. Because I think we've squandered a big lead, and I think kind of needlessly so. But But what's going on? I think, we're seeing, David touched on a lot of this. I think we're seeing kind of two ballot questions emerging. One that's very much focused on Trump and threats to our sovereignty, threats to our economy that are all emanating from the United States. And people who are concerned about that tend to be older, and more of them tend to be women. I think a lot of older voters consume a lot more traditional media and a lot more CNN and things like that, where they're getting a bigger pipeline of information around those issues and are more focused on it. They're also seeing impacts on their lives. The convulsions in the market, is much more acutely felt if you're on a fixed income and you're looking at your retirement savings and trying to figure out whether you're going to be eating cat food before you die, right? So, and also not as affected by some of the cost of living issues that are that David talked about for younger people, for millennials, for younger men. Because older folks are more likely to have a house already, and they're not having those same sorts of frustrations and issues around those affordability issues that younger folks are having. So I think the Conservatives in 2024 were very focused on cost of living. They got there very early on in terms of defining that as an issue. Interest rates, problems in our inner cities around crime and substance abuse. What other things would I say, David, in terms of that issue set? But broadly speaking, an affordability agenda. And that was really dominating politics in Canada in 2024. Trump comes in, wins in November. By December, he's hosting meetings of world leaders and others at Mar-a-Lago, and saying some pretty controversial stuff. Trotting out the 51st state narrative, all of that, and I think that really was jarring for a lot of people, not just in Canada but around the world, because some of these things were not really a part of the election debate that the Americans had just gone through. I don't recall any events talking about taking over Greenland or Panama or Canada because they didn't happen. That was all a big surprise. And a surprise that was going to affect a lot of Canadians' livelihood. So I think those issues coming on, big change. And the other, really big thing that happened was Justin Trudeau left office. And Trudeau, by the time he left, was incredibly polarizing and unpopular with the vast majority of Canadians. And I think people were happy to see somebody who was providing an alternative, and they just, were not giving a lot of examination to them because they just wanted to get rid of Trudeau. And so when Trudeau left, I think that it changed the nature of that discussion. So minus Trudeau, add in Trump, Carney comes in, different person, resume that seemed to be, more built for the moment that we were in, for those voters who were concerned about it. And the net result is the Conservatives go from 25 points up to running, nationally, like 6 or 7 points back. And in some key parts of the country, running, double digits back, so particularly Ontario, Quebec, and Atlantic Canada. So a very changed election. I don't think we've ever seen an election in modern, history at the federal level where we've seen such a shift in such a short period of time. Your other questions around healthcare, I guess.
I'll your really experience. Quickly. Yeah, on
Excuse me, Vassy. I just have to interrupt.
Of course,
I have to correct Kory on one thing. I don't think Trudeau was polarizing at the end. I think he was polarizing for a period of time, and then by the end, I think he'd unified everybody.
Right.
I think everybody was on one side. It wasn't polarizing anymore.
Yeah, I think that's probably true. Maybe
Kory's
even in
just
his own
known for his
household.
Generosity to Trudeau.
Right. I'm getting accused of that a lot these days.
So the healthcare question was essentially if we take Kathleen's point about how it's, for example, not factoring into the federal debate, it that despite the fact that both the NDP and the Liberals at the provincial level tried to talk a lot about healthcare, and there are very significant issues in the province of Ontario around access to healthcare, it didn't end up being like what you would think of as a huge election issue. Obviously, the Trump factor was a big part of that as well. Why do you think, though, that their messaging around healthcare didn't punch through more?
The answer was in the slides that you showed. Well, it's viewed as an important issue. There isn't a big spread between the parties in terms of who is best to deal with it. And I think if you pull a little more deeply on it, there's a lot of cynicism as to whether any one party is actually going to be able to do something that's dramatically different than what's going on. So you tend to see more debate around issues where there's a big differential in terms of support for the party on what they're talking about. So I don't think it punched through because I don't think people really believe that while they believe there was problems with healthcare, they didn't believe any one of the parties was going to be able to meaningfully bend the curve on it. And so it's not as polarizing an issue. It's not as good we talk about wedge issues in campaigns that cause voters to divide into one camp or another. That hasn't always been the case for healthcare. Very often it's been an issue where conservatives have scored very poorly. We're not seeing that as much anymore. We're seeing, more even splits between the parties. But as a result, I think it's less the point of differentiation. And so differentiation focuses attention and coverage and political efforts. That's part of it. The other part is just that was the peak of Trump mania going on. And it was just pushing everything else off the agenda. So I think a combination of those two things, maybe a bit of weak opposition leaders too. There wasn't a time for change sort of move that was anything close to what we were seeing at the federal level around Trudeau at that time. But certainly still people who are very unhappy with the direction of government at federal and provincial, and I think almost in every province right now. But I think that pertains more to what David was talking about earlier with younger voters. They're just very unhappy.
David, you want to jump in?
I thought the first point was really key, which is cynicism about whether anybody can do anything about it makes it a non-voting issue. I'm pretty sure that if, say, 50% of Ontarians believed that one party could really fix healthcare and get everybody a family doctor, they'd win the election.
But I would just disagree with that. And say, sure, in Ontario, I think that's true. And I think that's cynicism and a pox on all your houses. None of you are going to get the job done, no matter what party you fight for. But then you see cases like in Manitoba, where Wab Kinew ran a very disciplined campaign on healthcare, or Premier Houston, in Nova Scotia, where his first election was exclusively on healthcare, and he reoffered again on healthcare. You can have it come to the fore. And I think, it's early days still for Kinew, but he's trying to move the needle. And so we'll see if it really just kind of takes that kind of real commitment.
What is the takeaway, David? I'll throw it back to you, though, on the federal level, because I think a lot of people in this room are hoping for, we're all familiar with the jurisdictional separation, that provinces essentially are responsible for healthcare. But we have seen at different moments over the last number of decades, sort of a push for the federal government to either show up with more money or to hold provinces more accountable for the transfer of that money. Where does the issue lie for the federal political scene, in your view? And is there a way to circumvent what everyone's laid out?
Well, the feds have a really weak hand in healthcare negotiations with the provinces. First of all, you said everybody knows about the jurisdiction, and that's likely true in this room. But out there in the real world, nobody knows about jurisdiction or who's responsible for what. And if you tried to explain it to them, they wouldn't care. They just want the healthcare system to be better. And they think it's everybody's job who's in politics to be working at that. They don't think it's some people get to take that off and dump it on other people. So, but the feds, the feds don't really have a tool to enforce conditionality. And Quebec will never accept it. And increasingly, the English provinces won't accept it if Quebec doesn't accept it. I mean, Martin in 2005 was able to do a carve out for Quebec, but I think that's the last time. I think that's the last time that that's possible, to have one set of rules for English Canada and another set of rules for Quebec. And, there aren't really many healthcare experts in the federal government. They don't know a lot about healthcare. They don't deliver healthcare. And
well, they do in certain areas.
They do in certain areas, but and badly. So it's not like they bring a ton of intellectual heft to these conversations about what the healthcare system ought to be like. And so they're really just in the check cutting business, as near as I can tell.
I think the latter point there around lack of expertise is, for anyone who's worked in provincial government, it's very evident when you're dealing with the federal government on these issues. Like they have a depth of knowledge around drug approvals and things where they are more directly responsible. But in terms of, how to manage a hospital system or something, like, that expertise really does reside with the provinces, and it really does just come down to check writing.
So what's the implication for example, people in this room who want the issue of outcomes for children, health outcomes for children, to rise in significance for whichever government is going to be making decisions that impact those?
So one of the things you're advocating for is the chief children's advocate officer. Sorry if I've got the name wrong, but I think that's probably a good strategy. I mean, we've seen that happen with the science advisor, Mona Niemer. We've seen that happen with the chief nurse that was relatively recently appointed. That was a new position. Obviously, there's Dr. Theresa Tam as well. And just to speak to the chief nurse example, because that's the one I'm most familiar with, that office was temporary, right? And it wasn't clear if it was going to be permanent. But before the election, nurses, after the things that, she had delivered, she was delivering, demanded or asked of the Liberal government, so the current Liberal government, if it becomes a Conservative government, it could be overturned, but make that position permanent and give it, hopefully, the kind of same equivalency as an assistant deputy minister, right? Because you not just have to make the position permanent, but it has to have resources and power, right? Because without that, what can it do? And she's now making real recommendations on things like retention, recruitment, return of nurses that is really critical. So, that might be one model. And another model that I remember that I was a part of back in 2022, and I was talking about it with Lisa just a moment ago, was just that whole idea of just what it costs the economy. And I was referencing with her or recalling that Pedonomics report that came out, just what it costs the economy when our children are sick. And when parents, whether mothers or fathers, have to take care of them. And I know back in 2022, with that triple threat, COVID, flu, and RSV threat that happened, the numbers there were like 60 million hit to our economy. I mean, that's an effective way to push for your issues, right? And someone like Carney, who's looking, to build strong, whatever his slogan is, I can't remember. But
Canada strong.
Canada strong. But it's also like build something. I can't remember. This is what, he should focus on if he wants.
What is Jagmeet's slogan?
In it for you,
help?
Buddy. In it
help?
for you.
Is it help?
In it for you.
Help.
In it for you.
In it for
and I will make a slight minor correction to something that Emily said off the top. That Jagmeet Singh within the first week was advocating for healthcare big time. So on doctors, on nurses, on pharmacare, on dental care. So it hasn't punched through. So maybe it's more like media over here is the need, that he needs to be saying. But they have been consistent in that message on healthcare. And that's why you need to have New Democrats in Parliament.
Well,
both David and Kory.
He would help you, but he's trapped under something heavy right now.
Yeah. I wonder if, the answer is maybe not around, more metrics and reporting and things like that, to have better, information. I think the federal government could play a bigger role in those things. But I think the reality is, while universality of programs is something that's very popular and I think important in the sense that it brings Canadians together, at a practical level, it's very challenging, I think, with healthcare to have a series of solutions or programs that are going to work well from coast to coast. because the realities of healthcare in Saskatchewan are not going to be the same as they are in Toronto, which is not going to be the same as they're going to be in, Cape Breton Island or other places. And so the challenges that different jurisdictions are facing are complex and dissimilar. And one size fits all, Canada Health Act sort of measures will only take you so far, which is why I think it kind of defaults back to the check writing thing at the federal level more often than not. And we've seen similar things in other areas like childcare, how we do public housing. Like, there are very different models being pursued in different parts of the country. And it's very hard to impose from Ottawa one set of solutions that actually, yield outcomes. So anyway, that's why I kind of come back to maybe data collection and allowing, a little more experimentation within the healthcare environment, with more transparency and reporting to have, different jurisdictions learning from each other as to what's working and what isn't, and have like a bit of an honest broker in terms of the information that can verify that. So it's not just, the spin from
like
your
high or something.
Yeah, well, like, I think your like nursing position you talked about, like things like that actually make sense to me in the sense that, they can be public advocates and people who are shining a light on things that are working well or things that are not working well. And I do think that has an effect on driving things more into the political realm, more into election campaigns for discussion. But as long as people think that there's nothing anyone can do that's going to make it better, it's hard to get people motivated around it. And I do think there are different examples of things working well. Like, we've been, experimenting in Ontario with some changes in primary health care. And trying to pull in people from outside the Conservative Party to help with that. Dr. Jane Philpott's role in that, I think, has been important, and we'll see how that process goes. But let's just, for the sake of hope here, say that works well. Then it's something that you can, show other provinces that, look, this approach worked really well, and we're having better outcomes, and then I think it does become more easy to, there's a better case for that health issue writ large to be a factor in an election campaign, because you've got that thing that David talked about. You have an example of there's something we could do to make it better. And if you get people there, then healthcare will become a top issue.
Is there political incentive, though, at either the provincial or federal level, David, to share that information, to do that kind of accounting? Because the feds, for example, when they made the latest increase to the health transfers, promised that there would be a heightened level of accountability and transparency in reporting to Canadians, and none of it has manifested.
Yeah.
Well, no, there isn't a lot of accountability to voters in the system, because responsibility seems so diffuse to people that people never really know who to blame for what's going on. And it's a lot like our transit system in this country, right? Who's next do I joke about this? But I think that to get your stuff on the political radar, you really have to start thinking about this differently, I think, than what you're doing. So, children's health is a motherhood initiative. Everybody will agree with this, right? But what does that mean? What does that entail? What am I supposed, if I'm a citizen and you want me to support children's health, what am I supposed to do? What am I supposed to get behind? What idea am I supposed to support? There's nothing out there in the ether for me to grab onto like that. And then you get to, okay, so what, and you've got, I looked through the documents, a lot of ideas. And really, I think to be successful, you have to do something that is super difficult for coalitions like yours, and requires a lot of really hard work and consultation, which is pick something, one thing, and create a burning platform around it, right? You are the motherhood responses you get to your polls And when 92% of people agree with something, you have asked them a motherhood statement. You've not asked them a real question, right? But the motherhood responses do illustrate that there is goodwill there and a desire to do something there. But let me get really cynical with you, okay? There is people's stated opinions, and then there are their real priorities and opinions. So for years and years and years, I did a lot of research around childcare for various politicians, Paul Martin, Kathleen Monk, all kinds of people. And, people think this is a big political winner because it polls really well. If you ask people about childcare, you'll get very large numbers of people who agree with it. But I can tell you who will vote on it. People who will vote on it are mothers who have children who need childcare right now.
Right.
Not their husbands, not their parents, not anybody else. They'll all say childcare is a good thing, but the only people who will vote on it are people who need it. And so you have to understand how dominant self-interest is in voting decisions and voting determination. And one of the successes the childcare advocates had, was that they started to convince people that it was an economic issue and not a social policy for mothers, and that it actually had something to do with the success of the country writ large.
It was an infrastructure program.
Right.
Like literally, think of it that way.
Then more people could understand what was in it for them and get behind it. And even that was difficult for the childcare advocates to agree on a type of program they would even all advocate for, because having been through those wars, I could tell you that sometimes the childcare advocates were your worst enemies in trying to get childcare implemented, because they were attacking what you were doing for not being sufficiently pure. But in any event, this is my advice to you. Understand what the real politics is. Not the kind of questions that get you 92% agreement, but where does the rubber really hit the road here? And where can you really develop traction? My suggestion is kids' mental health. I think it's much easier for the average person right now to intuit mental health problems with children than physical health problems with children as a big, broad problem. And I think that a specific idea around mental health that was consistently articulated could generate a lot of support and could even become a political demand that politicians needed to respond to. But one way or another, you got to take this down from 30,000 feet, turn it into an implementable idea that has broad appeal. This is the key.
I just wanted to quickly mention before the other two jump in on that we will take your questions as well. So I think there are microphones, so please do step up and we'll take them as you come. Kathleen, what do you think?
I just have to laugh because New Democrats have been running on childcare forever. And so when the Liberals actually picked it up in the last campaign and then they were struggling and they're like, why isn't this more popular? Why aren't people voting for it? Like, well, you didn't ask us. We've been running on it for like decades and we knew that it wasn't popular. I agree with I agree with David's advice, in terms of obviously burning down to that one issue. I do think framing it as you have in the past, as an economic issue to how we can get our economy moving, ensuring our kids. I don't know if you have to narrow down on kids' mental health, although as the mother of two teenage boys, I would certainly advocate for that. But I think, or whether it's health broadly, as also a mother who just a few weeks ago was in the Emerge for 16 hours as well. And that was a hellscape, as I'm sure you all know. So I don't know what the issue has to be, but I do think, that's wise government public relations advice, narrow it down, focus it, talk to your allies. Like CMA has run a number of very focused campaigns over the years. Years ago, it was on seniors and they pivoted. You can talk to them about how they kind of pushed their agenda over the years. But it is important to be consistent and and I think one of the questions that you wanted us to address was how do we get into a new government early, right? And so, basically on the 28th, we'll know who wins. Hopefully, if it's clear, if it's a clear win for a majority or a clear minority, whatever, the summon that created the writ that triggered the election, there was also a summon for Parliament to return on May 26th. So if it is Carney, I would expect that he would get rolling pretty quickly. So, and expect a series of actions in that period of the spring. And so I think, mapping out who you need to talk to quickly, I wouldn't assume that the cabinet that was announced before we went into an election will be the new cabinet. In fact, I'm quite confident there'll be some new members being brought in. So making sure you map that out and really have your strategy in terms of getting into their offices.
You want to weigh in?
Yeah, we can do questions.
Okay, I think there's a lady up there. Hi.
Yeah. Okay. So throughout the conference, really at the beginning, we had been talking about how preventative care was so important for children and really for making healthier adults and having a major economic impact. If you remember, there was that statistics about like 77% of children or 18-year-olds actually couldn't qualify for the U.S. military, which was pretty bonkers if you think about it. And so I guess my question to you is, why do you think there hasn't been a message really around that economic story of healthier children will make healthier adults, which in turn we absolutely need, not just for defense, but to run our economy?
I think anything preventative is always a tougher sell. Both to governments and with voters. But governments in particular, and David, you and I have chatted about this lots of times in the context of different clients and folks who've come in with proposals. You always get the model of this is how much money it's going to save, or the economic activity, or whatever, if we take this preventative measure. Yet those savings, in all my years in government, I've never seen a saving booked next to a policy ever once. Like, there's no money that comes off the other side. And so it's a cost. And it's an argument that will get you eye rolls with government. It won't get you anything more than that. Like, you got to sell it on a different basis, I think. I think there is something to saying healthier kids are going to mean healthier citizens and better outcomes. Like, I do think there is an argument there. I just don't think there's an argument that's compelling to governments on the basis of, a preventative measure, yielding some sort of cost outcome or anything like that.
Yeah, and it really can't be reallocation. Like, I was intrigued by the chart in which people divided up the healthcare pie, and they divided it equally among the sort of three age groups. And if you ask people again about preventative measures, they will think they're brilliant, but not at the expense of their knee replacement, not at the expense of the timeliness of their knee replacement, not at the expense of anything in the acute care system, right? All the political pressure in healthcare is on the acute care system, and that's why the money goes, because that's where the political pressure is. And so any message that says, we really need to take some healthcare money from this pot and move it over to this thing, which would be better for society, is not going to work politically.
Do you think that, Kathleen, just about that, like what you are describing is like it's sort of taken over the health movement in the United States with RFK Jr., right? Like, they're not in the way that they're, obviously the way that they're describing it and the things that they're doing are not necessarily conducive to the outcomes that they're describing, but they're all about preventative and we're going to reform the way we think about health. Do you think that might, because of the way Canadians perceive the Trump administration, end up even having a worse impact here in Canada?
Yeah, I hope that RFK's ideas don't start drifting north. But I think that the question around preventative health for children is similar, and the needs for investment there is similar to the needs for investment in our education system. And that also gets rolled over, right? Like, that we, if we invested more in our education system and we invested more in our kids in a preventative health way, we'd create better citizens and therefore a more robust economy et cetera, et cetera, et cetera. But the challenge is, of course, that political cycles are short, and these, ideas in terms of implementing them and seeing the impact of them of a child from, 0 to 18 is long. And so how do you kind of keep that on the front burner for politicians to actually address when they're worried about their next electoral cycle? And even in the case of Ontario, and this is where I'll take a side swipe at my colleague Kory, where Ford has had, a government since 2018, but, we started with hallway medicine in 18. We went to hospital closure in 2022 in that election. And we're still in a health crisis in 2025 and it hasn't been addressed, right? So sometimes it's just not the top issue, right? And it could be because no one's wrapped their hands around it, or they just, they care about other things. Yeah, I'll let you, Shalon. Sorry.
It's half of every, all the dollars spent in any provincial government. It's half of them. And then you pay for education, and you pay for, sort of foundational welfare services. And then you've got 18 other ministries dividing up 10% of the money. And healthcare would eat 100% of the dollars. And probably still not meet the demands that the public has on the system, and that's the reality. And I this is why it comes down to a money thing in one way, but I'll come back to having more competition in terms of models and approaches that can use those dollars more efficiently in a way that can be replicated in other places. Like I think there is scarcity, and that's not fun, but that is at the core of a lot of what we're talking about. And that problem, I think, is going to get a lot worse. The aging of the population is going to put additional demands, and what David said about acute care being where the rubber hits the road for most people. So I think we're going to have additional cost pressures. And I think we're going to have our economy shrink. I think the chances that we're going into a recession, if we're not in one already, is very high. I think we're going to have a lot of bad stuff coming at us from south of the border in terms of the economy. And, the challenge of paying for everything, including healthcare, is going to be, much tougher. And it's going to require some additional sacrifice that people are have proven time and again to be pretty reluctant in making. So we've got to bring in more revenue, and we got to do some things differently in the economy if we want to pay for what we're doing now, let alone putting more money into it. That's not a fun piece of news, but I think that's true.
There's a question over here.
Yes, hi. So full disclosure, I'm with the CHC team. And one thing that we've been advocating for is a plan for kids. So basically, we don't know if kids from one province to another get the same level of service. We actually probably know that they don't. If you're an Indigenous kid, that's another whole story. So I guess my question is the idea of a plan for kid, so what we've been calling a national strategy for kids' well-being, let's say, is that sellable at the federal level? Because that would go hand in hand with that officer position that you've talked to, right? You create a plan, you get somebody to become the chief child health officer to implement the plan and be accountable for improved health outcomes for kids.
I can start first. I encourage you, I'm sure you already have, so it's stupid to say this, but talk to CMA. They did demand the plan for seniors for about 6 years. I can't remember the years. I know some folks have experience with CMA in the audience. So see if it worked, if it punched through. We don't have a plan for seniors yet. We don't have a chief seniors officer yet. So maybe cynically I would say no. But I think potentially the child officer approach is potentially, we did remember 2015 when Trudeau was elected, we had a youth ministry and he was the minister of youth, right? So could something like that happen? Sure, it's possible. Is there the, overwhelming public demand for that? I'm not sure.
Let's take a step back. What problem are you trying to solve? That this is critical to effective comms. If you introduce a policy solution before anybody knows there's a problem, they won't pay any attention to it. You have to establish the problem first. What is the problem with children? What does a plan for children mean? Like, sitting here, I don't have any idea what that would mean, what it would address.
I'm not sure I even know the problem with my children.
Where are your children?
So, I mean, I work a lot with people in the food insecurity business, right? And they have a lot of trouble agreeing amongst each other about what the right answer to food insecurity is. And they have a bunch of different target audiences of people that are food insecure and need help. But food insecurity, again, sure, that's a terrible thing. What am I going to do about it? Then they hit upon school food, right? It's not the consensus in that group of activists that that's the best policy to address food insecurity. Lots of people love a basic income. Lots of people love targeted programs for Indigenous, all kinds of things. But what could work politically? A school food program, right? Because it's also an affordability measure for the families who have kids. And it's something people can easily understand how that would be executed and how that would make a difference. So that's the kind of idea that you can sell. And I know that implies, as professionals, putting a lot of water in the wine of what you know about the complexity of these issues and the interrelationship between all these things and how stupid it is to focus on school lunches. But nonetheless, it's better than nothing, right?
I think we have another question over here.
Yeah, thanks so much. This has been so fascinating. To your point about kind of where are the children, for example, like, given the success of Trump's kind of movement around sociocultural, like we've lost our direction of sorts, we need to go back to the way things were. Is there merit in that kind of argument for healthcare with respect to children's mental health? So, for example, I'm thinking of our kids' mental health is suffering. Families are really struggling. We need to strengthen the family, strengthen kids again. Like that, because that's something certainly older generations could get behind. And then also parents could get behind if you're thinking 2 out of the 3.
Yeah. Yeah, I don't know the answer. It's probably not a very good answer. I'm not sure. I'm not sure whether that would resonate or not. But I do think that children's mental health is a big concern for a lot of people, a lot of parents, a lot of others. But to David's earlier point about what's the problem and what's the one thing or the big thing that you're going to do to help with that, because I think it's so big and complex that I think a lot of parents and others have difficulty getting their arms around it at all. I think there's general consensus that this is getting worse, but is it screen time? Is it locking down schools during the pandemic and the repercussions of that in terms of mental health? Is it the more online digital nature of how kids communicate and interact, and and how you monitor that, and as a parent or someone. I don't think there's a lot of understanding as to how to grab it and wrestle with it, and go back to a time before before smartphones. Like that would probably be something that people would say, yeah, that might be nice, but I just know that's never going to happen. So what else do you have?
But maybe there is, if I could just jump in for a second, I'm not an expert like you guys, but I'm a mom. And maybe there's a bit of evidence in that storyline as well of something that is working. And I would point south of the border to Scott Galloway, for example, and all the big movement underway there, where they haven't yet been able to show causation between social media use and cell phones and kids, but they have been able to show a clear distinction, particularly among young girls, in their mental health worsening at the same time as their social media and cell phone use exploded, particularly over the last decade. And he's been so convincing in the way that he's talked about that he's convinced governments at different levels to, and we do some of that here, including in Ontario and other provinces, but to ban cell phones. And he's convinced all these parents essentially that, and there's debate about it, but still, am I doing any harm by not letting my kid have social media until they're 16 or giving them a flip phone until they're 16. Like, there has been quite a bit of policy movement around that in the United States. So, and that's so focused that maybe jumping off what David pointed out
and
as
courageousness on behalf of some of the education boards in Ontario, at least, in terms of trying to take on big tech, right? Because of that, the lawsuits that they've initiated.
Yeah, his most convincing argument, in my view, is, I can't show causation, but what's the harm?
Kids' mental health is also a cross-partisan issue because, as you're pointing out in the States, there is as much serious thinking about this on the right as there is on the left. People are concerned about this all across the political spectrum. And so it's the kind of thing you can build consensus around.
That's a good point. I think is there another question here?
Thank you for your insights. The more campaigns, I have a comment first and then a question, that I watch, I'm reminded of James Carville's very simple statement. It's about the economy, stupid. And ultimately, people want to see economic growth and benefit from economic growth. My comment about a unifying, campaign issue even for children, and it is general, but can it be scaled down, would be access, healthcare access, because that affects all generations, all provinces, all Canadians. And I'm going to ask David what he thinks about that. And that's a vague question, but can you scale healthcare access? Pediatricians, primary care, subspecialists, hospitals. Can you build a campaign around that?
Probably not right now. Maybe in better times, maybe in more generous times, but people are not terribly generous right now. They're feeling really self-focused. They're really, really feeling cost of living pressures on their own. And any requests of people to sacrifice more standard of living for other causes, for other people, is pretty difficult ask right now. And that's why I return to, I think you have to find a way to position these asks in a way that it benefits more than just the recipient of the benefit or the aid. Because if it's that, it's charity as far as people are concerned. And maybe it could be done by charity. But if it affects the whole population in some way, like boomers, who's going to pay your CPP benefits? Right? If you can make it relevant to other people and say, I have some stake in this. I need this problem to be resolved for my own sake. It's really the only way to be successful in this business.
But do you not think that healthcare access affects us all? We all have a stake.
When we're sick.
We do all have a stake, but as soon as you start talking about the various different kinds of care people need, you're getting away from what are the healthcare access things that the broad population's focused on, which is I don't have access, which are two things in my view. Maybe you guys can correct me if there's more than two things, but it's I can't get access to a family doctor, or my kid can't get is out on their own now and can't get a family doctor. And second of all, emerge as a mess. These are the healthcare issues in the general population. And if you want to insert some other lens on that, it's got to be very compelling, because as long as those problems are there, I mean, I think this is an issue. Let's go back to the politics. I think this is one of the reasons why pharmacare isn't really achieving its full potential as a political issue right now, because I think it has the potential to be a very popular idea. But people kind of have a reaction like, you're going to add something. Why don't you fix the thing you've got, right? Before you add this new thing. I agree the new thing would be good, but presumably it will be just as crappy as the thing we've got now. So,
That's what John Horgan had said when he was first approached with. Yeah, sorry.
Well, but like there isn't a province in Canada that has been enthusiastic about the pharmacare program for that reason, because and there was very low levels of enthusiasm around the childcare program. Is when Canada Health Act came, was originated. It was a 50-50 cost shared program. It's like a 80-20. Well, maybe not quite that now. It's but 70-30. Provincially funded, and so it's not really welcome to many provincial governments to have the federal government come and say, we've got another great thing, and don't worry, it's going to be 50-50. And it's like, hey, no, fool me once, fool me twice, but like this is like fool me the fourth or fifth time on this, and the pressures from the public are so huge around service delivery, on fulfilling the promises that we have already made to folks, that there is not a lot of credibility out there, either at the government level or with the public, that somehow we're magically going to add a new entitlement program and it's going to work.
Okay, but then you go to someone like Wab Kinew, who has consistently said that is the economic horse that pulls the social programs, or this whatever, I can't remember how he phrases it, but we need the economic engine of the country to drive so we can have the social programs.
Horse and cart. Kory and I are from rural.
Yes,
horse and cart.
Horse and cart.
Horse and cart. And it's like consistently you have parties that are afraid or flip-flop or backtrack on economic changes that would actually bring more revenue into our coffers in order to actually pay for those programs. And I point out just the capital gains, $19 billion that we could have had, that both parties to my left and right, like the left, you've actually came to the Liberals actually implemented it, and then it's been,
Well, you can't tax your way to prosperity.
But I mean that's
guys. We don't have time for this fight. Just FYI, we're like not sure that's what they're here for, but also we're past time now. So we got to wrap it up there. My apologies. Save it for the show. Thank you very much, everybody, for having us. It's been a real pleasure. Thanks, my panelists.
Thank you so very much. This has been a really fascinating way to end the day and to end our program, actually. So a huge round of applause for Vassy Kapelos, David Hurley, Kathleen Monk, and Kory Teneycke. Thank you again. As CHC says, kids can't vote, but we can. So this is so important for all of us. And I've really appreciated the insights that they brought. Shockingly, in looking up the Debate Commission website, it's not that catchy, but it is bilingual. And for anyone who's looking for it, it's info@debates-debat.ca. So it's out there if you're interested in looking that up, Leaders Debate Commission.